Mr. Johnson is a 65-year-old patient undergoing a routine X-ray to monitor a previous lung condition. During the procedure, he expresses discomfort and requests to stop, stating that he did not fully understand what the procedure entailed. As the radiologic technologist, what steps should you take in this situation? Answer: in this scenario, the radiologic technologist must prioritize Mr. Johnson's autonomy and rights as a patient as established under the Patient Rights and Confidentiality Guidelines. According to the ARRT Code of Ethics and the principle of informed consent, patients must be fully informed about their procedures and have the right to refuse treatment at any time. Pause the procedure. Immediately halt the X-ray procedure to address Mr. Johnson's concerns. Provide information, explain the purpose, risks, benefits, and alternatives of the procedure in clear, understandable language. Ensure Mr. Johnson comprehends the information. Assess understanding. Confirm that Mr. Johnson has a clear understanding of the procedure and his right to refuse. Document interaction. Note Mr. Johnson's discomfort, the explanation provided, and his decision in the patient's medical record. This documentation is critical for legal compliance and protection against potential malpractice claims. Respect decision. If Mr. Johnson decides not to proceed after gaining understanding, respect his decision and refrain from conducting the procedure. By following these steps, the radiologic technologist adheres to ethical standards and legal responsibilities regarding patient autonomy and informed consent. What are the key differences between negligence and malpractice in the context of radiologic technology, and what elements must be present to establish a malpractice claim? Answer: negligence and malpractice both involve a breach of duty, but they differ in the context of professional standards. Negligence is the failure to exercise the care that a reasonably prudent person would exercise in similar circumstances. It can occur in any situation and does not require a professional standard. Malpractice specifically refers to negligence by a professional that results in harm to a patient. To establish a malpractice claim in the context of radiologic technology, the following elements must be present. Duty of care. The radiologic technologist had a legal obligation to provide care to the patient. Breach of duty. The technologist failed to meet the accepted standard of care, which could include improper positioning, incorrect exposure settings, or failure to follow safety protocols. Causation. There must be a direct link between the breach of duty and the harm suffered by the patient, demonstrating that the technologist's actions or lack thereof directly caused injury. Damages. The patient must have suffered actual damages, physical injury, emotional distress, or financial loss as a result of the breach. Understanding these elements is crucial for radiologic technologists to minimize their risk of malpractice claims and uphold patient safety. Under the Health Insurance Portability and Accountability Act, HIPAA, what are the key provisions that radiologic technologists must adhere to in order to protect patient information, and what are the potential consequences of a HIPAA violation? Answer: radiologic technologists must adhere to several key provisions of HIPAA to protect patient information. Privacy Rule establishes standards for the protection of health information, allowing patients control over their health information. Technologists must ensure that patient records are kept confidential and are only shared with authorized personnel. Security Rule requires safeguards to protect electronic health information, including administrative, physical, and technical measures. This includes secure storage of electronic records and limiting access to authorized individuals. Breach Notification Rule mandates that covered entities must notify affected individuals of breaches of unsecured protected health information. Minimum Necessary Rule requires that only the minimum necessary health information is shared for treatment, payment, or healthcare operations. Consequences of HIPAA violations. Civil penalties. Fines ranging from $100 to $50,000 per violation, depending on the level of negligence, with a maximum annual penalty of $1.5 million. Criminal penalties. Depending on the nature of the violation, individuals may face criminal charges, which can lead to fines up to $250,000 and imprisonment for up to 10 years, loss of professional license. A breach may result in disciplinary action by the ARRT, including suspension or revocation of certification. Maintaining HIPAA compliance is essential for protecting patient privacy and avoiding significant legal and professional repercussions. Explain the importance of the ARRT standards of ethics in guiding the professional conduct of radiologic technologists. What are the key ethical principles outlined in these standards? Answer: the ARRT standards of ethics serve as a foundational framework guiding the professional behavior of radiologic technologists. These standards promote accountability, professionalism, and ethical decision-making in clinical practice. The importance of these standards lies in their ability to enhance patient care, ensure that patient welfare is prioritized in all actions, leading to improved patient outcomes and trust in healthcare providers, promote professional integrity. By adhering to ethical standards, technologists demonstrate professionalism, integrity, and respect for patients and colleagues. Guide decision-making. The standards provide a reference for making difficult ethical decisions in various scenarios, such as end-of-life care or managing patient confidentiality. Key ethical principles outlined in the ARRT standards of ethics include accountability. Technologists are accountable for their actions and the consequences of their decisions. Integrity. Technologists must practice honestly and transparently, avoiding conflicts of interest. Respect for patient autonomy. Patients should be treated with respect and their right to make informed decisions must be upheld. Compassion and respect. Treating patients with empathy and respect is essential in all interactions. Commitment to continuous learning. Radiologic technologists must engage in ongoing professional development to provide the best care possible. Understanding and embodying these principles is critical for maintaining high standards of care and professional conduct in the field. Discuss the ethical considerations surrounding informed consent and refusal of treatment in radiologic technology. How should technologists navigate situations where patients refuse? A recommended procedure. Answer. Informed consent is a fundamental ethical principle in healthcare, requiring that patients understand the nature of the proposed treatment, including potential risks and benefits, before agreeing to it. In radiologic technology, informed consent involves ensuring that patients are fully informed about the imaging procedure, including the purpose of the procedure, possible risks, such as radiation exposure, alternatives to the procedure when patients refuse. A recommended procedure. Radiologic technologists must navigate the situation with sensitivity and professionalism. The following considerations are essential. Respect patient autonomy. Patients have the right to make decisions about their own healthcare, including the right to refuse treatment. Technologists must respect this decision as long as the patient is deemed competent to make it. Provide information. Before the patient refuses, technologists should ensure that the patient has all the relevant information needed to make an informed decision. This may include discussing the consequences of not undergoing the procedure. Document the refusal. It is critical to document the patient's refusal of treatment in the medical record, including the information provided to the patient and their understanding of the implications of their decision. Communicate with the healthcare team. If necessary, communicate the patient's refusal to the physician and other relevant members of the healthcare team to ensure coordinated care. By adhering to these guidelines, radiologic technologists uphold ethical standards while respecting patients' rights to make informed choices about their healthcare. What other potential ethical dilemmas a radiologic technologist might face in end-of-life care, and how can they ensure ethical decision-making in these situations? Answer. Radiologic technologists may encounter several ethical dilemmas in end-of-life care, including balancing patient wishes and medical advice. Technologists may face situations where patients wish to pursue imaging procedures contrary to medical advice, raising questions about autonomy and beneficence. Dealing with family dynamics. Family members may have differing opinions on the patient's care, complicating the decision-making process and possibly causing emotional distress for both the patient and the technologist. Informed consent issues. Patients may not fully understand the implications of undergoing imaging procedures at the end of life, necessitating careful communication about their choices. To ensure ethical decision-making, radiologic technologists can take the following steps. Open communication. Engage in open dialogues with patients and their families to clarify the patient's wishes and provide information about the implications of imaging procedures. Multidisciplinary approach. Collaborate with the healthcare team, including physicians, nurses, and social workers, to develop a cohesive plan that respects the patient's wishes and addresses their needs. Adhere to ethical guidelines. Follow ethical principles outlined in the ARRT standards of ethics and relevant organizational policies to guide actions and decisions. Continuous education. Stay informed about ethical issues in end-of-life care through continuing education, allowing for better support of patients and families in these sensitive situations. By adopting these strategies, technologists can navigate ethical dilemmas effectively, ensuring patient-centered care at the end of life. Describe the role of professional conduct and boundaries in maintaining patient relationships within the scope of radiologic technology. What are some examples of boundary violations? Answer. Professional conduct and boundaries are crucial for establishing trust and maintaining respectful relationships between radiologic technologists and patients. Adhering to these principles ensures that care remains patient-centered and ethical. Key aspects of professional conduct include Respect for patients. Technologists should treat all patients with dignity, compassion, and respect, recognizing their individuality and right to privacy. Maintaining professional distance. While building rapport is essential, maintaining appropriate boundaries helps prevent the development of dual relationships that could compromise patient care. Clear communication. Professional conduct involves clear, respectful communication with patients, ensuring they understand procedures and their rights. Examples of boundary violations include inappropriate self-disclosure. Sharing personal information with patients that is not relevant to their care can blur professional lines. Physical boundary violations. Engaging in unnecessary physical contact or failing to ensure patient comfort and privacy during procedures. How does cultural sensitivity impact ethical decision-making in radiologic technology, and what steps should technologists take to ensure culturally competent care? Answer: cultural sensitivity is vital in ethical decision-making within radiologic technology, as it influences how patients perceive care and make decisions. Factors include beliefs about health, illness, and medical procedures, which can vary significantly among different cultures. To ensure culturally competent care, radiologic technologists should take the following steps. Cultural awareness. Educate themselves about the diverse cultural backgrounds of patients, understanding their values, beliefs, and healthcare practices. Effective communication. Use interpreters when necessary to ensure clear communication, respecting patients' preferred language and ensuring they understand their options. Respecting beliefs. Acknowledge and respect cultural beliefs regarding health and treatment decisions, engaging in discussions that allow patients to express their preferences. Training and education. Participate in ongoing training related to cultural competence to enhance understanding and skills in delivering respectful and sensitive care. By incorporating cultural sensitivity into their practice, radiologic technologists can improve patient satisfaction, compliance, and overall health outcomes while upholding ethical standards. Explain the significance of the disciplinary procedures outlined by the ARRT and how they affect the practice of radiologic technologists. What behaviors may lead to disciplinary action? Answer: the disciplinary procedures outlined by the ARRT are essential for maintaining the integrity and professionalism of the radiologic technology profession. These procedures ensure accountability for radiologic technologists and protect the public from unprofessional or unethical behavior. The significance of these procedures includes ensuring professional standards. They help uphold the ethical and professional standards established by the ARRT, ensuring that technologists provide safe and competent care. Protecting patients. Disciplinary procedures safeguard patients from harm caused by negligence, malpractice, or unethical behavior of healthcare professionals. Promoting public trust. By enforcing standards, the ARRT fosters trust in the radiologic technology profession, assuring the public that practitioners are qualified and ethical. Behaviors that may lead to disciplinary action include fraud or misrepresentation, providing false information on applications or during the certification process, substance abuse, impairment due to drugs or alcohol while performing professional duties, criminal activity, engaging in criminal acts that reflect negatively on professional conduct, violating ethical standards, breaching the ARRT code of ethics, such as failing to respect patient confidentiality or engaging in inappropriate relationships with patients. By understanding the disciplinary procedures and the behaviors that may trigger them, radiologic technologists can uphold the highest standards of practice and protect their professional integrity. What role does patient confidentiality play in the ethical practice of radiologic technology, and what legal frameworks support the enforcement of confidentiality? Answer: patient confidentiality is a fundamental ethical principle in the practice of radiologic technology, ensuring that personal health information is protected and only shared with authorized individuals. It is essential for building trust. Patients are more likely to share sensitive information with healthcare providers when they feel assured of confidentiality, fostering a trusting patient-provider relationship. Legal compliance. Adhering to confidentiality regulations protects technologists from legal repercussions, including civil lawsuits and penalties. Legal frameworks supporting confidentiality. Health Insurance Portability and Accountability Act (HIPAA). HIPAA establishes national standards for protecting sensitive patient information, requiring that healthcare providers implement safeguards to maintain confidentiality. State laws. Various state laws may impose stricter confidentiality protections than HIPAA, requiring compliance with local regulations governing patient information. Explain the principles of radiation protection and their importance in clinical practice. Discuss how these principles can be applied to minimize radiation exposure for both patients and healthcare workers. Answer: the principles of radiation protection are founded on three key concepts: justification, optimization, and dose limitation. Justification: this principle requires that any exposure to radiation must be justified in terms of the benefits it brings. For instance, if a diagnostic procedure is unlikely to provide significant information for patient management, it should not be performed. Optimization, also known as ALAI, as low as reasonably achievable. This principle emphasizes minimizing exposure while achieving the desired clinical outcome. This involves using appropriate techniques such as collimation and filtration and ensuring equipment is well maintained to reduce unnecessary radiation. Dose limitation. This principle applies to occupational exposure where regulatory bodies such as the National Council on Radiation Protection and Measurements (SRP) set annual dose limits for radiation workers, typically 50 MSV, to minimize health risks. Together, these principles protect patients and healthcare workers from unnecessary radiation, promoting safe practices within clinical settings. Discuss the stochastic and deterministic effects of radiation exposure. How do these effects influence the approach to patient care in radiologic practice? Answer: radiation exposure can lead to two primary types of biological effects: stochastic and deterministic effects. Stochastic effects. These effects are probabilistic in nature, meaning they occur by chance and typically involve long-term risks, such as cancer. The probability of occurrence increases with dose but not its severity. The risk assessment for stochastic effects is often used in patient management and is fundamental in justifying the need for imaging procedures. Regulatory guidelines suggest maintaining exposure as low as possible while still achieving diagnostic objectives. Deterministic effects. In contrast, deterministic effects have a threshold dose and a severity dependent, and they result from a high dose of radiation over a short period. Common examples include skin erythema and radiation burns. In clinical practice, these effects necessitate strict adherence to dose limits and protective measures to prevent acute injuries, particularly during high radiation procedures. Understanding both types of effects is crucial for radiologic technologists to effectively communicate risks to patients and optimize protective measures in their practice. What is the significance of the ALARA principle in the context of occupational exposure for radiologic technologists? Discuss specific strategies that can be implemented in the workplace to uphold this principle. Answer: the ALARA principle is essential in minimizing occupational exposure to radiation for radiologic technologists. This principle is grounded in regulatory standards set by organizations such as the NCRP and the Occupational Safety and Health Administration (OSHA). Specific strategies to implement ALARA in the workplace include time management. Reduce the time spent near radiation sources. For example, technologists should prepare and position patients efficiently to limit exposure time. Distance. Increase distance from the source of radiation, utilizing techniques such as positioning patients appropriately and using remote controls when possible. Shielding. Employ appropriate shielding methods, such as lead aprons and barriers, to protect against scatter radiation during procedures. Monitoring. Use radiation monitoring devices to track exposure levels and implement periodic evaluations of radiation safety practices. By adhering to ALARA, radiologic technologists not only protect themselves but also foster a culture of safety within their work environment. Mr. Thompson is a radiologic technologist who has been informed that he will be performing several fluoroscopic procedures in one day. He is concerned about his potential radiation exposure. What steps should Mr. Thompson take to minimize his exposure while ensuring quality patient care? Answer: Mr. Thompson should take the following steps to minimize his occupational radiation exposure during a busy day of fluoroscopic procedures. Prior planning. He should review the procedure protocols beforehand to anticipate necessary actions and equipment, reducing the time spent in the radiation field. Utilizing shielding. He must ensure that appropriate shielding, e.g. lead aprons, thyroid shields, is available or worn during the procedures to protect against scattered radiation. Maximizing distance. Mr. Thompson should maintain as much distance as possible from the fluoroscopic unit and the patient, utilizing the control panel and remote controls when feasible. Time management. He should minimize the time spent in the direct beam path, ensuring that all positioning and setup activities are completed swiftly. Using radiation monitoring devices. By wearing a dosimeter, Mr. Thompson can track his exposure and adjust practices as needed to remain within safe limits. By implementing these strategies, Mr. Thompson can effectively uphold the ALARA principle while delivering high-quality patient care. Compare and contrast the units of Gray, Jai, and Sievert, SB. How are these units used to measure radiation exposure and biological effect? Answer. Gray GI and Sievert SP are both units of measurement used in radiation protection, but they serve different purposes. Gray GI. The gray is the SI unit that measures the absorbed dose of radiation. It quantifies the amount of energy deposited by ionizing radiation in a given mass of tissue, defined as 1 joule of radiation energy absorbed per kilogram of matter, 1 joules Jg. This measurement is crucial for assessing the potential for tissue damage and determining appropriate treatment dosages in radiation therapy. Sievert SP. The Sievert is the SI unit that accounts for the biological effects of different types of radiation. It incorporates a quality factor Q to reflect the relative biological effectiveness or BE of various radiation types. For example, alpha particles have a higher RBE than beta particles or gamma rays, meaning the same absorbed dose in GI may produce different biological effects. Thus, 1 S equals 1 J x Q. In practice, while GI measures the energy deposited in tissue, SV is used for risk assessment and regulation, helping to establish dose limits based on biological effects and informing safety guidelines. Describe the factors that influence patient dose during diagnostic imaging procedures. How can radiologic technologists mitigate these factors to minimize patient exposure? Answer. Several factors influence patient dose during diagnostic imaging procedures, including radiation technique factors. Factors such as kilovolt peak (kVp) and milliampere seconds mass play a crucial role. Higher kVp can reduce patient dose by allowing for lower mass settings, however, it may also impact image contrast. Patient size. The size and thickness of the patient significantly affect the dose. Thicker patients absorb more radiation, necessitating higher doses for adequate imaging equipment calibration. Well-maintained and properly calibrated imaging equipment ensures optimal performance and reduces unnecessary radiation exposure. To mitigate these factors, radiologic technologists should use appropriate imaging protocols tailored to patient size and clinical indication, utilize shielding devices, e.g. lead aprons, to protect sensitive organs, optimize imaging parameters based on the ARRT principle, ensuring the lowest necessary dose while achieving diagnostic quality. Discuss the different types of radiation monitoring devices used in healthcare settings. What role do these devices play in maintaining safety standards for radiologic technologists? Answer. Radiation monitoring devices are essential tools in healthcare settings for ensuring safety standards for radiologic technologists and patients. The primary types of monitoring devices include personal dosimeters. These include film badges, thermoluminescent dosimeters (TLDS), and electronic dosimeters. They measure cumulative radiation exposure over time and are worn on the body. Personal dosimeters provide critical feedback on occupational exposure levels, helping technologists remain compliant with regulatory limits. Area monitors. Used to measure radiation levels in specific locations, area monitors help assess environmental radiation and identify potential contamination in imaging rooms. Survey meters. These handheld devices measure the intensity of radiation in an area and can detect different types of radiation, alpha, beta, gamma. Survey meters are vital for routine checks of equipment and areas where radiation is used. The role of these devices in maintaining safety standards includes tracking individual exposure levels to ensure compliance with dose limits, typically set at 50 MSV annually for radiation workers, identifying and mitigating potential radiation hazards in the workplace, providing data for safety audits and compliance with regulatory standards set by organizations such as the NCRP and the U.S. Environmental Protection Agency (EPA). What considerations should be taken into account when performing imaging procedures on pregnant patients? How do federal regulations guide the management of radiation exposure in pregnant workers? Answer. When performing imaging procedures on pregnant patients, several key considerations must be addressed to ensure the safety of both the patient and the developing fetus. Risk assessment. The risks of radiation exposure during pregnancy must be carefully assessed. The American College of Radiology (ACA) and the Radiological Society of North America (ARSNAWI) guidelines emphasize that imaging should only be performed if the benefits outweigh the risks. Alternative imaging modalities, whenever possible, non-ionizing imaging techniques such as ultrasound or MRI should be considered to avoid radiation exposure. Use of shielding. If imaging is deemed necessary, lead shielding should be utilized to protect the abdomen and pelvic region. For pregnant workers, federal regulations, particularly the NCRP Report No. 116, guide the management of radiation exposure. Key points include pregnant radiation workers should inform their employers of their condition to implement appropriate safety measures. The dose limit for the embryo fetus is set at 0.5 msv per month and a total of 5 msv for the entire pregnancy, aligning with the principle of dose limitation. By adhering to these considerations and regulations, healthcare providers can safeguard the health of pregnant patients and their unborn children. Explain the principles of collimation and filtration in radiation imaging. How do these techniques contribute to dose reduction and improved image quality? Answer: collimation and filtration are critical techniques used in radiation imaging to enhance safety and image quality. Collimation. Collimation involves limiting the size and shape of the X-ray beam. By restricting the beam to the area of interest, collimation reduces unnecessary exposure to surrounding tissues, effectively decreasing patient dose. Additionally, collimation improves image quality by reducing scatter radiation, enhancing the contrast and sharpness of the resulting images. Filtration. Filtration refers to the use of materials, e.g., aluminum, placed in the X-ray beam path to absorb low-energy photons that contribute little to diagnostic information. By removing these photons, filtration lowers patient dose while maintaining image quality. The use of appropriate filtration helps to ensure that the radiation that does reach the patient is of sufficient energy to penetrate tissue, effectively contributing to the quality of the diagnostic image. Both techniques play a vital role in the ARRT principle by minimizing unnecessary radiation exposure while ensuring high-quality imaging results. Discuss the regulatory framework surrounding dose limits for occupational exposure in radiologic practice. How do these regulations influence the operational practices of radiologic technologists? Answer: the regulatory framework governing dose limits for occupational exposure in radiologic practice is primarily established by the NCRP and the U.S. Nuclear Regulatory Command (NRC). Key components include dose limits. The NCRP recommends an annual dose limit of 50 msv for radiation workers, with additional recommendations for specific populations, e.g., pregnant workers should have a limit of 5 msv for the duration of their pregnancy. Monitoring requirements. Regulations mandate regular monitoring of radiation exposure through the use of personal dosimeters. This ensures that radiation workers are aware of their exposure levels and can take appropriate actions to minimize risks. Training and education. Regulatory guidelines also emphasize the importance of training and education for radiologic technologists regarding radiation safety practices, helping to foster a culture of safety within healthcare settings. These regulations influence operational practices by requiring radiologic technologists to implement safety measures, adhere to established protocols, and continually evaluate their exposure to ensure compliance. Why is it essential to conduct regular maintenance and testing of radiographic equipment? Describe the potential consequences of neglecting these practices. Answer: regular maintenance and testing of radiographic equipment are crucial for ensuring patient safety, image quality, and compliance with regulatory standards. Equipment malfunctions can lead to poor image quality, resulting in misdiagnosis and inappropriate treatment plans. Furthermore, malfunctioning equipment may expose patients to unnecessary radiation doses. According to the National Council on Radiation Protection and Measurement's SRP report No. 159, institutions should implement a quality assurance quality control (CAC) program to regularly assess the performance of radiographic equipment. This includes testing for KVP accuracy, timer accuracy, and proper function of the automatic exposure control (EC) system. Failure to adhere to these guidelines could result in serious consequences, including legal liabilities, loss of accreditation, and damage to the institution's reputation. Explain the importance of implementing a quality assurance quality control (CAC) program in a radiology department. What are some key components that should be included in this program? Answer: a CAC program in a radiology department is vital for maintaining high standards of patient care, optimizing diagnostic imaging quality, and ensuring compliance with regulatory requirements. The program helps identify and rectify issues that may affect equipment performance, thereby enhancing patient safety and diagnostic accuracy. Key components of a CAC program include regular equipment testing, scheduled assessments of radiographic equipment performance, including KVP, timer accuracy, and AEC function, staff training and education, ongoing training for staff on equipment operations, safety protocols, and quality standards. Incident reporting system, a mechanism for reporting and analyzing incidents related to equipment failure or suboptimal image quality. Record keeping, documentation of all CAC activities, including testing results and corrective actions taken. According to the American College of Radiology (ACA) guidelines, a comprehensive CAC program is essential for achieving optimal imaging outcomes and minimizing radiation exposure. Describe the principles behind the operation of a three-phase X-ray generator compared to a single-phase generator. How do these differences impact image quality and radiation dose? Answer. A three-phase X-ray generator operates by utilizing three alternating currents that are out of phase with one another, leading to a more constant output of X-ray energy compared to a single-phase generator, which has a single alternating current. The primary differences include beam quality. Three-phase generators produce higher average beam energy, resulting in improved penetration and reduced patient dose. This is essential for imaging thicker body parts. Image quality. The continuous energy output of three-phase systems minimizes fluctuations in X-ray intensity, leading to more consistent image quality with less image noise compared to single-phase systems, which exhibit higher fluctuations. The NCRP recommends three-phase systems for their efficiency in producing high-quality images while minimizing radiation exposure to patients. Mr. Johnson is a radiologic technologist working in a busy hospital radiology department. He has noticed that the image quality for digital radiography doctor systems has been declining. After discussing this with his colleagues, he decides to conduct a quality control check on the image receptor. What specific tests should Mr. Johnson perform to assess the performance of the DR system, and what actions should he take based on the results? Answer. Mr. Johnson should conduct the following tests to evaluate the performance of the DR system. Spatial resolution test. Assess the image receptor's ability to accurately depict fine detail. This can be done using a resolution test pattern. Uniformity check. Evaluate the consistency of image density across the receptor by exposing it to a uniform radiation field. Sensitivity test. Measure the receptor's response to varying levels of radiation exposure to determine if it is functioning optimally. Based on the results of these tests, Mr. Johnson should take appropriate actions. If the spatial resolution is poor, recalibration or replacement of the image receptor may be necessary. If uniformity issues are found, adjustments in the imaging technique or equipment positioning may need to be addressed. Should sensitivity tests indicate a significant decline, the receptor may require replacement or further technical service. Discuss the significance of testing the automatic exposure control (AEC) system in radiographic equipment. What are the potential implications of an improperly functioning AEC? Answer. The automatic exposure control (AEC) system is designed to automatically adjust the exposure time based on the amount of radiation reaching the image receptor. Testing the AEC system is critical for several reasons. Consistent image quality. A properly functioning AEC ensures consistent image density, which is crucial for accurate diagnosis. Fluctuations in exposure can lead to images that are either too light (underexposed) or too dark (overexposed), compromising diagnostic value. Radiation safety. An improperly functioning AEC may cause unnecessary radiation exposure to patients. If the system does not terminate exposure when sufficient radiation is detected, it could result in higher doses than necessary. Regular testing and calibration of AEC systems are recommended by the NCRP and American Association of Physicists in Medicine (OPPM) to ensure optimal performance and adherence to safety standards. Compare and contrast high-frequency generators with single-phase generators in terms of efficiency and clinical application. What are the advantages of using high-frequency generators in modern radiology? Answer. High-frequency generators operate by converting the incoming current into a higher frequency, allowing for a more efficient and consistent X-ray output. Key differences and advantages include efficiency. High-frequency generators produce less ripple in the output voltage waveform, leading to more consistent and higher energy X-ray photons. This results in improved image quality and reduced radiation dose. Clinical application. High-frequency generators are ideal for various imaging modalities, including fluoroscopy and computed tomography (CT), where precise and high-quality imaging is required. Additionally, high-frequency generators are typically smaller and lighter, making them more suitable for mobile and compact radiographic systems. The FDA has established guidelines that encourage the use of high-frequency technology in radiology to enhance patient safety and imaging effectiveness. What specific parameters should be evaluated when testing computed radiography (CR) systems compared to digital radiography doctor systems? Answer. When testing computed radiography (CR) systems, the following parameters should be evaluated. Sensitivity. Measure how well the CR system converts X-ray exposure into digital signals. This is typically assessed by analyzing the system's signal-to-noise ratio (SNR). Spatial resolution evaluate the ability of the CR system to produce sharp images, which can be assessed using a resolution test pattern. Exposure index, I check the I value to ensure that it falls within the optimal range, indicating appropriate exposure levels. In contrast, testing parameters for digital radiography doctor systems focus on dynamic range. Assess the range of exposures the system can accurately depict, which is typically broader. In DR systems. Image processing algorithms evaluate the effectiveness of image processing algorithms in enhancing image quality. Explain the importance of testing and maintaining fluoroscopy equipment. What are the regulatory guidelines governing the quality control of fluoroscopic systems? Answer: testing and maintaining fluoroscopy equipment is crucial for ensuring patient safety and high-quality imaging. Regular testing helps identify any issues that could lead to excessive radiation exposure or poor image quality. Key aspects of fluoroscopy equipment maintenance include radiation dose monitoring, regularly assessing radiation doses to ensure they remain within acceptable limits, as excessive exposure can pose significant health risks. Image quality assessment, conducting tests to evaluate the resolution, contrast, and noise levels in fluoroscopic images. Regulatory guidelines governing fluoroscopic systems, such as those set forth by the NCRP and the American Society of Radiologic Technologists, ASSO, mandate that facilities implement a comprehensive quality control program. This includes routine performance checks, staff training on equipment usage, and maintaining detailed records of all quality control activities to ensure compliance with safety standards. What are the key considerations when implementing tomography in a clinical setting? Discuss the advantages and limitations of this imaging technique. Answer: when implementing tomography in a clinical setting, key considerations include patient positioning. Accurate patient positioning is crucial for obtaining high-quality tomographic images. Misalignment can result in artifacts and diagnostic errors. Equipment calibration. Regular calibration of tomographic equipment is essential to ensure accurate slice thickness and imaging depth, which directly impact image quality. Radiation dose management. Tomography often involves higher radiation doses compared to conventional radiography. Therefore, protocols must be in place to optimize exposure while maintaining diagnostic efficacy. Advantages of tomography include its ability to provide detailed cross-sectional images of anatomical structures, enhancing diagnostic capabilities for conditions that may not be visible in standard radiography. However, limitations include increased radiation exposure and longer examination times compared to traditional imaging techniques. How do factors such as filtration and KVP settings affect the beam quality and quantity in radiographic imaging? Discuss the implications for patient dose and image quality. Answer: filtration and kilovolt peak KVP settings are critical in determining the beam quality and quantity in radiographic imaging. Filtration. The use of aluminum filters in the X-ray beam helps eliminate low-energy photons that contribute to patient dose without improving image quality. Higher filtration increases beam quality by enhancing the average energy of the X-ray photons, resulting in better tissue penetration and improved image quality. KVP settings. Increasing KVP settings enhances beam quality by producing higher energy X-ray photons, leading to improved penetration of dense tissues. However, higher AVP also increases the quantity of radiation produced, which can raise the patient dose if not managed carefully. The NCRP recommends optimizing KVP settings and filtration to balance image quality and patient dose, ensuring that radiographic imaging is performed safely and effectively. This optimization is critical for complying with the ALAI as low as reasonably achievable principle, which aims to minimize unnecessary radiation exposure.